Greetings, Lyons Elementary School District 103 community. My name is Chris Rivera, Superintendent of Schools, and I'm here to provide you with an educational update about the upcoming school year. My objectives for this presentation are to notify the school community of the start of the school year, an upcoming vaccination opportunity, the possibility of a COVID-19 screening initiative, and an overview of the recently released guidance for schools. The start of the school year, teachers and aides begin August 16th and 17th with Institute Days, followed by the students beginning school on August 18th. Vaccination notice. Lyons School District 103 has recently partnered with North Shore Clinical Labs and has provided, just in the recent past, 2 rounds of the Pfizer vaccination. We are looking to provide another opportunity of vaccinations, and the timeline is listed here. The week of July 19th, which is next week, we're working with North Shore Clinical Labs to provide the first round of vaccination, of the Pfizer vaccination. The following week, we are looking to host, led by the North Shore Clinical Lab staff, an information session on vaccines. The purpose of this is to help inform the community. I know that there is some individuals who may not feel safe yet, and it's just to have the medical experts have a Q&A and information session on the vaccinations. And then the week of August 9th would be the second round of vaccination, and the intent of this is to be fully vaccinated prior to the start of the school year for those who are eligible. And who can take advantage of this vaccination opportunity? Students, staff, and family members ages 12 and up can take advantage of the vaccination. By having the vaccination at this time, it provides students, staff, and family members that are eligible the opportunity to be fully vaccinated prior to the start of the school year. The exact dates are yet to be finalized, and we will communicate those via email, phone messenger, Facebook, and the website once all dates are determined. I did meet with the North Shore staff yesterday, and they assured me that they will be able to mobilize this for next week. I am awaiting to hear the exact dates and times, and then I will communicate those out as soon as I get those next week, hopefully Monday. COVID-19 testing. Lyons School District 103 may partner with North Shore Clinical Labs to implement a COVID-19 screening program. As this develops, details about the program will follow. This program will be free of charge to the district and families, but may be billed to individual families' insurance. COVID-19 screening has proven to help keep students in school at a higher rate by preventing outbreaks and lessening the amount of quarantine time due to a quick response rate on a PCR COVID-19 test. And again, the PCR test is the most valid test on the market at this time. More details will be provided once the plan becomes finalized. Finally, the Illinois State Board of Education, Illinois Department of Public Health, and CDC guidance related to how to implement a safe school environment next school year. I did provide here the full CDC guidance, and that can be viewed at this web address. Please feel free to type that in, and you can look at the guidance in its entirety. I will go over the key takeaways provided by the CDC related to guidance for the 2021-2022 school year. As we go through the key takeaways, keep in mind the language states should and recommends in many areas. This means we have some local decision making in these areas where in the past it used to say must and shall. And the final bullet here, a layering of mitigation strategies is also encouraged, and layers can be added and subtracted depending on the local community transmission, vaccination coverage, screening testing, and outbreak rates. And what this means is if there's a 0 or very, very low percent positivity rate with a high vaccination rate, mitigation steps can be added or subtracted depending on that. On the flip side, if they're very high positivity rates and a low vaccination rate, then we can add all of the mitigation strategies as well. So again, that's where a little bit of, as we go over the guidance in the next several slides, keep in mind that those things, we have flexibility to make some decisions within our own district on those levels and layering them. So keep that in mind as we go through this. And again, these next few slides are straight from the CDC website. This is not Superintendent Rivera's information. I am just passing information on. So this language on the next several slides about the key takeaways is straight from the CDC website. And the first bullet here states, students benefit from in-person learning and safely returning to in-person instruction in the fall 2021 is a priority. Vaccination is currently the leading public health prevention strategy to end the COVID-19 pandemic. Promoting vaccination can help schools safely return to in-person learning as well as extracurricular activities and sports. Masks should be worn indoors by all individuals ages 2 and older who are not fully vaccinated. Again, this says should, not must. Consistent and correct mask use by people who are not fully vaccinated is especially important indoors and in crowded areas when physical distancing cannot be maintained. CDC recommends schools maintain at least 3 feet of physical distance between students within classrooms, combined with indoor mask wearing by people who are not fully vaccinated to reduce the transmission risk. When it is not possible to maintain a physical distance of at least 3 feet, such as when schools cannot fully reopen while maintaining these distances, it is especially important to layer multiple other prevention strategies such as indoor masking. Screening, testing, ventilation, hand washing and respiratory etiquette, staying home when sick and getting tested, contact tracing in combination with quarantine and isolation, and cleaning and disinfection are also important layers of prevention to keep schools safe. Students, teachers, and staff should stay home when they have signs of any infectious illness and be referred to their healthcare provider for testing and care. Many schools serve children under the age of 12 who are not eligible for vaccination at this time. Therefore, this guidance emphasizes implementing layered prevention strategies, for example, using multiple prevention strategies together consistently to protect people who are not fully vaccinated, including students, teachers, staff, and other members of their household. COVID-19 prevention strategies remain critical to protect people, including students, teachers, and staff who are not fully vaccinated, especially in areas of moderate to high community transmission levels. Localities should monitor community transmission, vaccination coverage, screening, testing, and occurrences of outbreaks to guide decisions on the level of layered prevention strategies, for example, physical distancing and screening testing. So what's next? Surveys to the families are to come out next week so that we can feel or find out the feel and the level of comfort the community has on some of these areas for which we have local control. Also, what's coming up are meetings with the union groups to discuss how to implement the guidance and to find out their comfort level with layered mitigation strategies. Also coming up are the vaccinations for the community at George Washington Middle School beginning next week. Again, specific date and time to follow, hopefully on Monday. And then COVID testing screening program that is still in development. Once that is finalized, I will communicate that to the community and to the different employee groups. And then continued communication with the Alliance School District 103 community as a whole. Thank you for listening to this presentation. If you have any questions, feel free to call or email me directly, and my contact information is here for you. Thank you so much, and have a great day.